Hello everyone, this is Dr. Vijay Raghavan. Let's talk about this common killer habit called smoking. A cigarette is the only consumer product which is when used as directed kills the consumer. Very interesting quotation. It is not abused, it is used as directed kills the consumer. Quitting smoking is not a sacrifice, it is an investment in your future. Another very important quotation. Quitting smoking is not a sacrifice, it's an investment in your future. Before we jump into the topic, let's get to know what is a habit and what is an addiction. Habit is learned routine behavior which is under voluntary control and which can be changed with effort. Whereas addiction is an involuntary compulsive need for a substance or a behavior despite the knowledge that it is harmful. Every word is important. It's a compulsive need for a substance. It is involuntary and you know that it is harmful, but still you cannot prevent from consuming it or having that behavior. Habits can be negative or positive, whereas addiction is always destructive. So what are the differences between habit and addiction? Number one is control. Habit can be controlled by and large and with willpower, while addiction causes loss of control and hence a person continues in spite of his wanting to stop. I want to stop it, but I can't stop it. That's the status. I don't have a control on myself. Second one is consequences. Habits may be harmless or mildly negative, while addiction leads to a damage in relationship, health, and career. The third component is dependence. Addiction increases a physical and psychological dependency, while habit does not cause dependency. I cannot live without alcohol. I am dependent on alcohol. I can get away with smoking because smoking is a habit. Fourth one is brain impact. Addiction alters the brain's reward and pleasure pathways, creating a permanent need for the substance. And the fifth one is flexibility. While habits are flexible and can be modified quickly, while overcoming addiction is a complex long-term process. So what are the common habits and addictions? The common habits are smoking, nail biting, coffee drinking, social media watching. That's the last one is a habit for all of us. Why nearly all of us? All of us have the habit of social media watching. When it comes to addiction, it is alcoholism, drugs, gambling, severe pornography, gaming addiction. Now this gaming addiction has come into existence. The gaming addiction is again often reported of late, leading to a loss of enormous amount of money. Betting online, that is gaming addiction. Now coming to tobacco smoking. Interesting aspect to consider are active smoking, passive smoking, smoking of other combustible tobacco products, smokeless tobacco, electronic nicotine delivery system. These are all in things now. I am not smoking, I am only using electronic nicotine delivery system. We'll see to that effect. So now we know that what are the types of smoking which are our health hazards. Now, what is so dangerous about smoking? Why is it dangerous? Because cigarette smoke contains more than 7,000 chemicals. The harm is caused by exposure to these chemicals. The harm is determined largely by the extent of the smoking, like duration of smoking, and amount of smoking per day. Quite obvious. If you are exposed not only the large amount per day, for a longer duration, the damage is going to be more. Repeated inhalation of this complex mixture of cigarette smoke poisons at a high daily doses for many years lead to immediate, short and long-term health problems affecting almost all major organs of the body. The important point to remember is this. Smoking is the single most important cause of preventable disease and premature death. Now coming to immediate health effect. As soon as you start smoking, what happens? Respiratory symptoms like coughing, phlegm, wheezing, difficulty in breathing starts. You are prone to repeated respiratory infections. It causes absence from work or school and nicotine addiction. So what are the intermediate effects? These outcomes are not dependent on present smoking but having smoked in the past. Important point is cessation of smoking reduces the risk of intermediate adverse health effect. But having smoked always have an effect. The damage you have caused to your body will continue to be there. Common issues in immediate effect is absenteeism, often due to prolonged illness when compared to non-smokers. Heart issues begin early in life due to smoking. The blood vessel blockage, which we call it atherosclerosis, sets in early in smokers and it depends on the amount of smoking done. Other issues of intermediate origin is asthma-related issues, lung cancers, faster deterioration of lung functions. Smoking affects immunity, that is, ability to fight infections leading to development of pneumonia. So, smokers are more prone for pneumonia. The direct effect of smoke on the windpipe makes them more prone for throat and lung infections. Tuberculosis affects smokers more and the severity with the TB is also more. Diabetes is seen more in smokers and complications of diabetes like heart and kidney issues are more and early in smokers. Obviously, dental issues are more common in smokers. Adverse surgical outcome. Smokers have less wound healing capacity and hence are more prone for complications after surgery. When the person is bedridden after surgery, lung complications are more. These are the dreaded issues for a surgeon who is operating on a smoker. So what are the long-term issues? These are the major issues. The important point here is that cessation of smoke might reduce the risk, but still the risk is more than the non-smokers. Oh, I stopped after 40 years of smoking. Now I'm going to be healthy. No, it cannot be true. So what are the long-term effects? Cancer, blood vessels issues, COPD, bone issues, eye issues, rheumatoid arthritis, coming to ever-threatening disease called cancer. Most important danger is the cancer. All of us are aware that smoking causes cancer. There are 12 different types of cancer that are caused by smoking, starting with lung, mouth, larynx, that is a voice box, esophagus, that's called food pipe, urinary bladder, pancreas, kidney, uterus, breast, stomach, blood cancer, large bowel cancer, liver. So ever so many organs of the body develop cancer because of smoking. Now next issue is this blood vessel issues. Narrowing of the blood vessel is a major issue with this earlier onset in smokers. As we said, as we grow old, our blood vessels become thicker. That is an aging process, like our graying of hair, developing hearing problems, vision problems, prostatic enlargement. Our blood vessels become narrower. But smoking enhances this. So your narrowing of a blood vessel is going to happen earlier in age when compared to a non-smoker. So when the blood vessels are narrowed, it has an effect on many parts of the body. Heart issues like coronary artery disease, that is leading cause of death in a smoker. The blood vessel supplying the blood to the heart gets narrowed and he develops heart problems. Due to narrowing or blocking of the vessels to the brain, the commonest cause for stroke in youngster is smoking. Aortic aneurysm. This is an enlargement of the aorta, which is a major blood vessel in the body. It happens in the abdomen and this is the leading cause of death in smokers. Aortic aneurysm is very, very common in smokers. Third important thing is your lung disease. We call it chronic obstructive pulmonary disease. COPD is very commonly quoted everywhere. This is an irreversible damage to the lung a smoker can achieve. So this narrowing, because of the swelling of the lining of the airway passages, leads to airway obstruction, which in turn leads to incomplete emptying of air from the lung during expiration. This trapped air prevents proper oxygenation and washout of carbon dioxide as air is not fully expelled at expiration. certain amount of air is staying in your lung itself. It is not coming out. So it contains more carbon dioxide and less oxygen. So that is the reason smokers have lesser oxygen in the blood and more carbon dioxide, because the air exchange at the lung level is defective because of retained air even at the end of expiration. With smoke coming in direct contact with the lung and the windpipes, it is no wonder that lung disease is the commonest cause for prolonged illness and death in smokers. It is obviously related to the duration and severity of exposure. So how long you have been smoking and how many cigarettes you have been smoking per day. 80% of this COPD is seen in smokers. Other important cause is asthma. Of course, asthma is another allergic disease causing narrowing of the air passage, leading to retention of air even at the end of expiration. Now, what are the other organs affected by smoke? Eye. Cataract is more common in smokers. There is an entity called macular degeneration, a progressive disease causing loss of central vision. Blurring and distortion is caused by smoking due to damage to the macula. What are the issues on bones and joint? Smoking causes rheumatoid arthritis or rheumatoid joint disease, and it causes more hip fracture, especially in postmenopausal women. Now coming to a very important topic, maternal, fetal and infant health issues in smoking. This topic cannot be overemphasized. First component is smoking reduces the chance of conception. The fertility is reduced both in men and women because of smoking. First, they don't conceive. Thank God for it. Now, pregnancy is vulnerable time of life both for the mother and the fetus. A fetus is a growing baby inside the mother. The effect of smoking leads to adverse pregnancy, like abortions. Pregnancy outside the uterus, what we call it ectopic pregnancy. It increases the complications of pregnancy. It causes early separation of the placenta, leading to baby death at the time of delivery. And it can produce even preterm delivery before the due date. What happens to the baby? Baby may have growth restriction or low birth weight. Baby may have multiple organ impairment including the lung. The baby's lung is affected by the smoke which was inhaled by the mother into her lung. That is the communication. Baby may have multiple developmental defects, death of the unborn baby or fetal death we call it, sudden infant death. After baby is born, suddenly the baby will be dead. Death of the baby before 1 year of age is more in smoking mothers. Next issue is mother smoking after the delivery. It is obvious that child is going to be affected because of passive smoking, with all the deleterious effect affecting them from the early childhood. Here is a baby which was exposed to nicotine inside the uterus. Outside, immediately after birth, he is exposed to nicotine. So he will have the maximum damage to all the organs of his body. Another important warning is, one significant issue is that pregnant women need not be an active smoker. A passive smoking is equally dangerous, especially if the spouse is a heavy or a chain smoker. So we talked about various organs that are affected, how even the fetus is affected. So what are the factors that affect the impact of smoking on the health? Number one, nicotine dependency. As we started saying, smoking is only a habit, but a stage is reached, the person becomes nicotine dependent. Number two, intensity of smoking. The number of cigarettes smoked per day. Number three is likelihood of smoking cessation or chances of remaining smoker. Obviously, the health issues are going to be more in those who have started smoking early in life and those who are chain smokers. In younger person with organs still in stage of development, the deleterious effect of smoking is very high. Younger the onset of smoking, chances of cancer is obviously very high. Now comes to the topic of second-hand smokers. This is a most important component. A smoker in the family is equal to a family of smokers. The effect and complications are same in active and passive smoking. As we've stressed before, baby is a smoker even if one at home smokes. The effect of second-hand smoking is the same in immediate, short-term and long-term effect as we saw in the active smokers. Let's clear a few doubts. Does it make a difference between various types of tobacco smoking? Answer is clear no. Whether you smoke cigarette, cigar, pipe or BDs, the toxicity is the same. Another common question, whether hookah or water pipe smoking is less dangerous as it filters through the water column before inhalation? The answer is definite no. The next question is smokeless tobacco smoking, is it any better? As of today, the effect of electronic nicotine delivery system have not shown to be any less dangerous than a normal smoking. Thank you very much for your kind attention. We'll see you another day with another topic of interest. This is Dr. Vijay Raghavan signing off. Bye.